Hello everybody, this is a video for not only ladies but also for their husbands or their significant other also to listen to this video because it will help their loved ones to have the process to go smooth. Okay, so I'm going to try to make it as right on the point and really short and sweet, so hopefully you understand. I want to alleviate all these videos that I create is basically to alleviate your stress and any type of questions that you may have. Hopefully they're answered. Just pretty much that's where I'm here. I'm here to create all these presentations that I can and just help at least one woman. Okay. All right, let's go ahead. This is the Explant series part 4. I hope that you watch part 1, part 2, part 3. There are different areas of the Explant surgery explanation, your medications, what things you have to look out for choosing the right appropriate Explant surgeon, and so on. So go ahead and watch those videos. All right, let's go ahead. So on consultation day, you wonder, what am I supposed to do? What I'm supposed to, I hope after you go over to video number 3, that will talk more about, I'm sorry, video number 2, which will talk about more on the surgeon or how the surgeon that you're going to pick is the right one for you. So after you know that's the surgeon you want to go forward, you're going to call them up at the office and schedule a consultation. This is something coming from me, not just because being a nurse, but also being part of the healthcare field. You gotta have to understand you're taking a little time off their schedule, and sometimes in life it's not as always perfect in the office, so things may just seem to be on a time frame to do certain things. So you have to be ready. You have to be ready before you walk into their office. Make sure you have your list of questions written down. Also for the husbands, if any questions you have for as a caregiver, if you're going to be there to be a full-time caregiver at the first couple of days for surgery for your wife or your girlfriend, just make sure to also ask your questions. Okay. And I believe that consultation day is a perfect day to really figure it out if this is the doctor I'm going to move forward. If not, it will be a no-no. So also I want to also mention that to have your intuition, to have to be able to apply that intuitive feeling that you may have, right? Once you meet a doctor, the first meeting or whoever you meet, you get that extra sense of knowing, okay, this is the right doctor for me. This is the right place I want to have my surgery, and you're going to know from that day on. Okay. So finding out your plastic surgeon, you're going to call the office, schedule a consultation, have those ready questions to go, right? And there can be many, many questions that you may have. I mean, this is a general questions I put down here. That's for you to kind of have an idea. But the only questions, obviously, since knowing a lot for my side of being as a nurse, I know exactly questions I ask. The one question I had is basically what day before surgery I'm going to have those labs, right? So that was the one question I had. So basically, you can ask questions like, doctor, am I going to be a good candidate for lift, for example, if you're interested in having a lift? There are various ways of having a lift, and the doctor will tell you the different types that he does, and he will be right on the point of what you are looking for. But he will let you know right then if you're a candidate or not, or hear this out, or he will know on the day of the surgery. You're like, oh no, if I drove all this way, Also keep in mind, the consultation day is not always in person, also can be in virtually, like in telehealth. So you have to call the office and find out what's best for you. So I was living closer at the by the office, so I came in person. So if you're really interested in having a lift, let him know. My candidate, if he says, "Oh, I'm not going to know today, but I'm going to let you know," I'm gonna pretty much decide on the day of surgery. Basically, he's asking to fully trust in and to make the best decision possible for your body, for you. I know you may understand, you may think like, but he's a surgeon. He should give me an answer. I'm going to have to be honest with you. It doesn't work like that all the time. It just doesn't work like that. We wish everything goes perfect in your mind as far as life, but sometimes life doesn't work like that, right? So you have to kind of be, that's only one thing I tell you, you have to be absolutely 150% that the doctor that you choose is the right one for you. I fully trusted on Dr. Dev, so I pretty much went along with what he decided to do and what was his recommendation. So in my case, he recommended not to have no lift. So I didn't have no lift. And you asked me why was not a lift candidate. So basically, I'm going to go by parts. So lift is basically for any woman that may have extra tissue, uh, extra nipple size, for example, or like the way the nipples may point down. The doctor has this mathematical, this incredible way of how they very carefully go about surgery. So they will have more in detail in that area. So I just know more like in general. So if you are not, listen to this, if you're not planning to have a child in the future, that will be a go-to procedure, okay? In this case, for a person maybe like me that planning to have a child in the future, that will be a no lift, okay? There are studies where certain procedures may affect the breastfeeding part of it once it comes down when you become a mom. So they basically leave it alone. So in my case, planning to have a child in the future, that will be a no lift. Okay. All right. You're going to ask me all these terms. What is this? What is going on here? So all these terms is basically ways of how they remove your breast implants, right? How the way of you're being cut, or how the ways they're taking out the capsule. So all this right here, total capsulectomy versus en bloc, is something that I'm going to share you with very quickly on a video, so that way we can go by detail. I don't want to extend any videos as you know, I want to make it more short and sweet type of videos. So that will be in next video, hope. Okay, just look out for it. So what would I expect on pre-op? So that's one question that you can ask. Obviously, as a nurse, you know that basically you're gonna get a very general lab work. Okay, so lab work where they're gonna ask you to come into the office, depending on the clinic that you're going to, they all run differently. They can tell you come in a couple of days before, maybe a week before. So it's up to the clinic, right? So you're gonna ask what a kind of blood work are these? So this is CMP, okay? This is basically, it's called comprehensive metabolic panel. So in this one entails, it's like they're gonna read different types of levels as far as your blood glucose level. They're gonna look at your renal system and how it is, how it's running properly, and also it's gonna check your liver enzymes as well, and see if how everything is working for you. So this is really important test for them to find out. And this is called CBC, complete blood count. So they were gonna definitely tell about everything in details as far as your blood, what type of blood, you know, like your white blood cell count. They're gonna check on that. They're gonna check on your red blood cells, and gonna check on your hemoglobin level, hematocrit level, areas of your, pretty much your, if you're anemic or not, things like that. So they're going to say how well you have as far as your neutrophil, different types of white cells. They're going to check if you are in a risk of being either immune, or if a risk of, or they're going to check if you have high levels of infection. So it's interesting to know, because once you meet somebody, you're like, oh yeah, that person looks healthy. But once they do the lab work, they're going to say, okay, there's something going on in your body that you don't know. So they're going to definitely rule out everything possible thing once they take out those lab work, and they can go ahead for that surgery. Also, they're going to check for your how your heart is going. They're going to check on your cardiac rhythms if you have any abnormality, something that they need to look into further. In case that you have some kind of abnormality going on in your heart, they're going to send you for a clearance. They're going to send you to the order in order for a cardiologist to look into further. That way that you can move on forward for the surgery, right? The post-op day, basically, that will be the next day of surgery, like I mentioned in that previous video. So you can ask him when is the next days. Like I said, every place is different. So you can ask him. So for me, if you're going to DEV, you'll have it usually the day after surgery. You're going to ask him further questions about the tapes and things like that. But just remember, those areas you can ask him generally. They may tell you specifically, because everyone is different. Maybe the times are different as far as, like, I noticed in different clinical settings, they change ways of running the place. So this is now, I'm telling you this on June of 2023. You may see this video on 2025, who knows? But I'm just letting you know that things change, okay? All right, so remember, make sure to ask questions on pre-op, what labs you're gonna take, that way you can be ready. Also for post-op, when it's going to be the day for post-op. As far as what medications will I be prescribed, I showed you video previously on what medications Dr. Dev was prescribed to me. And like I said, it's not the same exact medications. Probably they changed the brand of medications. So just kind of give you an idea. Just check out that video. And okay, so that's another video. The same video, I believe, video 3 of Explant Series Part 3. It would talk to you more about the services that doctors offer. And in this case, Dr. Dev was offering other services to be able to manage your pain, like a nerve block, for example, and also banana bag, which is more like IV fluids that help to correct any deficiencies that you have in your body, like electrolytes and so on. So you can ask them. You can ask them depending which doctor you're gonna go. You still ask Dr. Dev. I mean, like I said, practices change over time. So you can still ask. That's a great question. And also, what items would I receive on day of surgery? Like I told you in previous videos, you're gonna wake up on the day of surgery with a surgical bra and also an ACE wrap tightly around your area of surgery. So that's something expected. And you can ask him, for example, like if you're going to give they're going to be given another surgical bra or just one, little simple things like that. And you can ask him also when you go to your consultation, ask him as far as other items. If you decide to go with this doctor, ask him what items you suggest for you to start collecting, things like that. Those are the areas that I place it in my Pinterest, so you check it out. I use all kinds of different products that I use for my massaging and also for the healing and everything else. So you can check it out on my page so you can see more or less what things I actually gather. All right, so another thing, what special qualities, this is the thing you have to keep in mind as far as when you go to this consultation. You have to ask yourself, what special qualities does this surgeon have apart from others? So what doesn't make him special, right? Why am I going to choose him, right? So just for me to you, I would just make it simple. Write down all that special qualities that you find in this person. Could be from experience, could be from like positive patient reviews and so on. Put them on paper and compare with versus other surgeons that you actually seen or you're about to see, things like that. So, like I said, you can compare personalities. If some surgeons either they put the drains or not put the drains. You can compare between prices, location. The list can go on and on. So I just want to give you more like an idea to narrow it down quickly and more effectively in that way. So another thing, from consultation, once you gather all the information from consultation day, you can also, like I said, I'm really more like a research type of woman, type of person. I just love to find out as much as I can. And I love to really hear from the patient. I like to hear from people's reviews of how they feel after surgery or why they chose Dr. Dev and why they went to the other doctor. In that way, you can just kind of have that, more like a emotional support and at the same time more information straight from a patient. So it's actually great. So you can actually follow, you can go under Facebook, there's a Dr. Dev support group, and also an Instagram, which is this is my personal Instagram. This is actually my baby. This is my first social media that I ever created. I have my personal, like private Instagram for just like family and friends, but I have never created any type of social media lines or connecting with the public at all. This is my very first time because I have been postponing it for so many years. Everybody has told me, Savannah, you need to go out there and educate. You're great at this, blah, blah, blah. I just kind of brushed it off because, from the pandemic and all the times that we've gone through, there was no time for that for me, because I was working in the hospital. But anyways, I really want to connect with you all. I want to connect with you, with your heart, and just allow you to vent with me. Just be able to connect and able to help as much as I can, right? All right. So basically, just make sure, right, make sure to review your notes. Review your notes of what you've collected from all the different surgeons that you have. Just make sure to kind of narrow it down to the one ultimately. And after you go through different consultations like I had, I've been through consultations at the hospital, different types of clinics, and I just came down to Dr. Dev. I made a video how I ended up choosing him. And also, you know, like I said, comparing and join different types of support groups and types of groups where women actually sharing their experience. So these are just areas, places where you can find me. Like I said, I went all out about social media. Like I said, I don't edit any videos, by the way. I am truly sorry for any mistakes I've made. I've made so many different weird sounds as far as my way of speaking, and you know, my accent goes crazy sometimes. And anyways, I apologize. Thank you for your patience. Anyways, so you can contact me. My main way of contacting me is mentalhealth.bii@gmail.com. Any questions that you have, any questions, feel free to email me. Okay. I do say that because it makes it easier on my side as far as collecting those questions and being able to make up like presentations in the proper way to really lay out the information. I'm a really detail oriented. As you can see, I love everything in order. I love everything, you know, in that way. So at the end of the day, remember, you are the captain. Okay. You are the capitana, captain of your own health. Just keep that in mind always. Okay. You're like, what do you mean? But the doctors know everything. At the end of the day, remember, we're all humans. You are the one that's going to decide which direction you're going to take with your own health, right? You are the one that's going to decide, yes, I'm going to go forward with this surgeon, or not, you're not going to go with the surgeon. So you have to, ultimately, you're going to decide. But remember, you're the one that runs the show. So you're the one that's going to be really, how you say, you're going to exercise the beautiful voice that you were given, and let anybody, like doctors, nurse, how you feel, what concerns you may have, or what questions you may have, feel free to share them with them. That's why they're there for you. They're there to help you as much as they can, but you have to be the one that's going to, you know, navigate through the seas, right? The seed of information, the seed of whatever you are going through. So you have to trust in yourself in that area. You're the captain. Remember, you're the captain. All right, everybody, if anyone, like I said, have any questions, okay, feel free to contact me here. I'm going to collect those questions as I go and create presentations. And last and not least, thank you. Thank you. Thank you from the bottom of my heart for being part of this channel, wherever you see me. If it's in YouTube, TikTok, Instagram, I don't know where, but I just want to let you know, thank you so much, because I'm able to really share my passion on education and share my passion on helping others, sharing the passion of just trying to create this little, trying to create this little community where we all like become a family eventually, you know, get to know each other. I'm there to be there as much as I can to help you. And like I said, thank you so much. And have a wonderful day.